morning. So Paul actually gave the disclosure. So the disclosure I have is that what you're about to hear, I actually created, and so there's a business around it, so just understand that through the talk. I speak very fast, but let's do it. Let's have some fun. I wanted to start off, Chris, where are you? I agree with you 100% that kids aren't just little adults. There's one big issue with that. I have 3 little boys, and I brought one of them to Denver recently, and that's what happened. I'm not sure how that works. Kids are little adults until you get to Denver, and then watch out for marijuana. Okay. Okay, you guys know what these lines are? This is the rate of survival for out-of-hospital and in-hospital pediatric cardiac arrest. So the hospital folks are doing great, right? The pediatric folks are, they're actually doing better. They're at 30% survival. Look at the survival for out-of-hospital pediatric cardiac arrest. It's 6%. It hasn't budged in 20 to 30 years. What are we doing wrong? Okay, so this is a great book. You should all read it. This is the psychology behind resuscitation, and hopefully this is something you've probably never heard before, and I really want to teach you about it. System 1 and System 2, okay? So System 1 is the part of your brain that you cannot control, okay? It's what happens when you look at someone, that automatic feeling that you have, and for those of us in the room who are in healthcare, it's when you walk into a room and you see a patient and you know the diagnosis, it's when you know the treatment, it's what comes to you automatically, okay? So the people in here who have been doing this for 10, 15 years, you have System 1 down pat, it's automatic, it's reflexive, you can't do anything about it. System 2, on the other hand, is the part of your brain that you have to dig deep into, okay? It's very slow, and by the way, it's very lazy, okay? So System 2 is no place for emergencies, okay? And let's practice a little bit. Which line is longer? Okay, so the people who said the line is the same length are correct. They've seen this before. Your brain, your System 1, automatically will tell you the top line is longer, and now that you know it, the next time you see it, System 2 will have to correct System 1 every time to let him know, no, idiot, it's the same exact thing. System 1 will jump at that top line every single time. Answer this question really quickly. Scream it out. Oh, okay, exactly. So for the people in here who are saying 2, which in studies at Harvard, they found that 75% of people will say that this answer is 2. But what you have to notice, it wasn't Moses. Your System 1 sees a biblical character, it switches Moses in for Noah, and it keeps on going. This is called the Moses illusion, and I'll show you how it applies to us in pediatrics. Let's do some System 2 stuff. You ready? Give me an answer. This is your brain now saying, oh crap, are you kidding me? You want me to do what? Okay? So System 2 is very lazy, it's sitting on the recliner, does not want to wake up. Okay? Walking in the streets of New York City is System 2. Because if you're not paying attention, you will get run over. Something that you all know about is System 2 is texting and driving. Okay? You cannot text and drive because when you're driving, that's System 1 for the most part. If you want a System 2, that's texting and driving, okay? Very difficult, not the best thing to do. System 2 has a cost though. If you're an ER person, an EMS provider, and your System 2 is not functioning, that means the gas tank is full. But as soon as you start tapping into System 2, your gas tank starts to become empty. So, being confident in front of a family, using a length-based tape, doing 24 times 13, making D25 out of D50, those are all things that will take your gas tank and make it empty. What happens when your gas tank gets empty? You look like that. What happens when you look like that in an emergency for pediatrics? You run, okay? And so that is the basis for a scoop and run in EMS. It's because your System 2 has been depleted, your gas tank is empty, and you're running like hell, and you have to refill diesel fuel. Okay? Rapid assessment. Let's check your System 1 out. I want you to tell me sick or not sick. Ready? Real quick. Sick or not sick? Okay, here's the next one. Sick or not sick? That's automatic. That's your System 1 talking to you. That's emergency medicine. And the very last one, sick or not sick? Very sick. Okay, very sick. Okay. Okay. Okay, so here we go. 60-year-old male. Let me show you how good your System 1 is for adult medicine. Hypoglycemic 60-year-old male. What's the answer? It's that, okay? 50 of that. Asystole, 60-year-old male. It's just that. Okay, look how easy that was. You want to give Benadryl to an allergic reaction. It's just that, okay? Very simple. That's system 1, adult medicine. Let's go to pediatric medicine. 5-year-old male. What's a dose of dextrose? D25 for hypoglycemia. What about asystole? What about the allergic reaction? Can you give me the volume dosage of any of these things? Don't feel bad because my 7-year-old can, okay? And we're going to show you his video in a minute. We've created a system that makes this system 1, okay? Currently, for everyone in this room, it's system 2, okay? Try this at home. Go back to your department and ask your folks, what's a dose of epi for anaphylaxis? What's your dose of fentanyl IM, which I love? I use 1.5 mics per kilo. What's your dose of midazolam for seizures? All these 3 answers, by the way, on the current length-based tape, are all Moses illusions, okay? Because the dosages for all those answers, let's take fentanyl, for example, that is 60 micrograms. 60 micrograms is the induction dose. The only dose of fentanyl you find on this tape is the induction dose. Do not look at this tape for the fentanyl dose. So, that's Moses illusion, right? So I went to Dr. Slovis and I said, hey, these are the 10 commandments. And he said, no, they're not. These are the 2 tablets of 5 commandments. Okay, so there's been lots of research done on all these errors in emergency medicine and EMS, and all the answers are, these are all system 2 problems, okay, we have to remember that. Is epinephrine even being given to pediatrics for cardiac arrest? We're going to be publishing a very big study coming up in May where we're using NEMSIS data, or we're calling it the PREPARE trial, pre-hospital pediatric arrest receiving epinephrine. Our preliminary data shows that infants are only receiving epinephrine in cardiac arrest 35% of the time, okay? Imagine if I told you that the adult cardiac arrest in your patient population are only getting epinephrine 35% of the time, whether you believe epinephrine works or not. You would have a meeting tomorrow, okay? This is happening around our country. This is a 50-state number, okay? This is what I've mandated in all my departments. This is the PED-NTED, the ABCDE. They have to arrive, bag, compress, drill, and give epinephrine. And they do this in 2 minutes. They package the patient, and they all know the dose before walking out into the scene. They do not use a tape. They can look at the mom straight in the eye and know the dose, and we're going to show you that right here. This is my son Jordan. He's 7 years old. The little one at the bottom, that's my 5-year-old Noah. He's the assistant actor there. So, but Jordan's the main character here. So Jordan can tell you the dose, the volume of epi, atropine, Ativan, bicarb, dextrose, saline, all by giving him an age. The paramedics that I work with hate when I bring him to the department because they know what's about to happen. So listen to Jordan giving you the epinephrine dose for ages 1, 3, 5, 7, 9 out of order, and then I'll ask him a simple math question at the end, and you'll see him have the system to it. Here we go. Your brother just drowned in a pool. He needs help.
Jordan, please don't use system 2.
Don't use system 2, Jordan. Here we go. Let's see the epi dose. If he's 5 years old. 9 years old. 1 year old. 3 years old. 7 years old. Okay, let's do what's 19 plus 14? System 2.
3.
System 2. Okay. All right, so this is what George presented, George Ross presented for you guys last year here. This is our system where we basically have all system 1, and basically there's no math anymore, and that's what we're trying to do. It's an age and a length-based system. I'm not a believer in the length-based system. I'll say it here today. I believe in age-based. The top 10 children's hospitals in this country use age. I think we should all do that. We're going to change PALS. Drowning 6 months ago. This happens in my department. Okay? Rafael Torres, great medic. Let me show you what he did. He arrived on scene at 14:02 patient contact, 14:02 and 45 placed an IO, 14:03 gave epi, 14:06 gave epi again. Okay? This happens and it works. The data. This was done at Denver Health by Dr. Lara Rappaport, who works with Dr. Caldwell, and they actually did a study of our system against the current length-based system. They used a simulation, and they did about 300 simulations, and this was just presented at NMSP last month, and you can see the difference in the accuracy of the dextrose. Epinephrine, there was no difference. You can see without looking at this slide in depth, the cognitive errors are what happened in this study. The system 2 was what got them, and that's why our system worked better. Now, the post-simulation survey, they had just looked at our box for the first time, and then after the study was done, they said, which ones do you like better? And we're very happy to see that in an overwhelming majority, they like to use system 1 in cardiac arrest. It's really a no-brainer. Let me go back to this, my last slide. I showed you this graph, and I told you this was the cardiac arrest data for out-of-hospital and in-hospital cardiac arrest. What if I told you that this was a graph, once you intubated a lady, and her end tidal went up to 30, okay? You'd be happy with that red line, wouldn't you? What if I told you that the end tidal stayed at 6? What would you do? You would pull the tube, right? Okay? It's time, folks, to pull the tube on pre-hospital, pediatric emergency care. We have to rethink it, we have to refocus, we have to do this all over again. We have to remove System 2 from pediatrics and EMS and in the emergency department, and we have to improve outcomes. Thank you very much.